for being here, Lokako. Welcome, Hawaii Preparatory Academy, Ohana, families, friends, and guests. Thank you for joining us online. My name is James Eustace, HPA class of 2003, and I'll be your moderator this evening for our second COVID-19 vaccine information session. During this evening's session, we hope to provide you and your families information and assurances you seek as you consider the COVID-19 vaccine for your keiki. We are grateful to be joined by local doctors and lead representatives from Hawaii Preparatory Academy to share with you and your families information about the COVID-19 vaccines that are available, their efficacy, and their safety, particularly as it relates to our younger children. Our speakers this evening include Dr. Dworkin, infectious disease specialist at Queens North Hawaii Community Hospital, Dr. Pulling, pediatrician at Paniolo Pediatrics and Family Medicine, and Dr. Zimmer, medical director and doctor of naturopathy at Pacific Quest. And of course, Fred Wawner, Hawaii Preparatory Academy interim head of school. And also on our call this evening, we have a lead member of the HPA Safety Committee, Amanda Bamba, RNC, and Director of Health Services. And assisting with technology, we're grateful to have our HPA marketing team, led by Mileka Lincoln, HPA class of 2002, and of course, Jared DeGroot, our digital communications manager. After hearing from our speakers this evening, we'll be spending some time answering questions that you might have. We're grateful that you've submitted some questions ahead of time as well. If you have questions during this information session, please be sure to use that Zoom Q&A feature to submit your inquiry. We will also be monitoring the YouTube chat for any other questions that might arise. We do hope that tonight's forum and webinar will help guide your decision for you and your family. Mahalo. So to start things off, I would like to welcome in our interim head of school, Fred Wawner, to share a few words with us and provide us some overall goals and safety goals for Hawaii Preparatory Academy going forward. Welcome, Fred, and thank you for having me facilitate again this evening. Aloha.
James, thank you so much. Aloha, friends at HPA. Thanks for joining us. Again, my name is Fred Wawner. I'm the interim head of school here at HPA. Most of our K-8 students know me as the guy that opens the car doors in the morning, which is often a bright spot in my day. We're so grateful to have our community health leaders here, Dr. Pulling, Dr. Dworkin, and Dr. Zimmer, as well as Amanda, our head of health services. So thank you all for taking time out of your busy schedules to share your wisdom with us. HPA's goal in hosting this event is to provide medical information to our community around vaccination for our K-8 student population. We are excited that we have access to a vaccine for this age group. We are optimistic that vaccination is our safest and best path forward in order to resume student learning in the best way possible. A key determining factor to our success in delivering on our mission will continue to be the prevalence of vaccinations within our HPA community. We are grateful for everyone's participation in our parent survey. We sensed both excitement and fear around the ability to have our K-8 students vaccinated. At this time, HPA has decided that we will not mandate COVID-19 vaccine for our kindergarten through eighth grade students for the remainder of this spring semester. With that in mind, it is likely that we will require the COVID-19 vaccine for our village campus students as soon as full FDA approval is granted. We want to let you know our intentions at this stage because we want our village campus Ohana to be as informed as possible as you make decisions based on what is best for your own families. We believe COVID-19 is a medical issue that requires us to follow the lead of medical experts. We hope today's information will allay any fears or misinformation that is out there. While we are prepared to continue community screening tests for our village campus in the spring semester, we do believe that our best risk mitigation strategy will be vaccination. It is important for us to honor where everyone is in this conversation and to continue to be open and honest about our approaches based on the information and knowledge we continue to gain. We will continue to do our best to give you as much information as we can for you to make informed decisions for your student and your family. We respect all our families and your ability to choose your own path. We do hope that your decisions will ultimately be in alignment with the health and safety procedures of our entire HPA community. I'm extremely grateful for your continued support and your participation in this webinar. Thank you very much for joining us, and I'm excited to learn from our doctors.
Mahalo, Fred. Thank you so much for that lead there. Really to dive in here and really have a conversation with our doctors and learn about their experience and a little bit of their background. I'd like to welcome in, first of all, Dr. Melissa Pulling, once again, our pediatrician at Paniolo Pediatrics and Family Medicine. Welcome back, Dr. Pulling. Thank you so much for joining us.
Yes, thank you. Well, we did a talk to the HPA, mostly the high school kids, this past fall. And we answered some questions at that time, but I think we're getting a younger group of parents for this webinar. So if you don't know me, I am a parent at HPA. I have a senior daughter, and I've lived in the community now for 5 years. I'm a pediatrician at Paniolo Pediatrics and Family Practice. Yeah, I'm happy to answer any questions. We have had some that were already submitted. And I will say, I've been answering questions mostly the past few weeks for this group, ages 5 to 11 in the office and phone calls and everything. And most of the questions are all quite similar. I understand parents' fears because they are making an important decision for their child. But I would like to just start off and just tell you a story from early in my career. And I think it just highlights by not making a decision, you were still making a decision. So the story I wanted to tell was when I was back early in my career, almost 20 years ago. I was a pediatric resident in San Francisco at a children's hospital. And I had infant baby whose parents had not vaccinated their baby. And this child had gotten sick with pertussis, which is whooping cough. And that baby was really, really sick, had to be intubated and was in the ICU for a long time. The baby fortunately did not die. But I will say the parents' biggest wish was that they could go back in time, and they really wish they had vaccinated their child. So I just want to start off with that story, but it's something to think about.
Thank you, Dr. Pulling. I appreciate you being here. Next up, I'd like to give a little time to Dr. Jonathan Dworkin, who's an infectious disease specialist at Queens North Hawaiʻi Community Hospital. Welcome back, Dr. Dworkin. Appreciate your time being here with us this evening.
Mahalo, thanks for having me on. Yeah, the situation at North Hawaiʻi Hospital is considerably better than the last time I was with you guys. It was a bit desperate at that time. A little bit of background, since I think Melissa's right that this is probably a different group of parents. I'm an infectious disease doctor. I trained at University of Hawaiʻi, internal medicine residency program in Honolulu, and I was an ID doc in Honolulu for about 10 years. And when the hospitals merged, I started coming over here and providing service a couple days a month, and realized what was the best island to be on, and it wasn't the one I was on. So we moved our family over here last year, and I just want to express my appreciation to the entire community for being so good to us and so good to my son in particular. We are very stoked to be part of the community here, and it's been an honor to serve in the hospital. There were some excellent questions submitted about the vaccine, and I'd like to get into it. I want to leave time for Dr. Zimmer as well. I just wanted to encapsulate a few and see if I could kind of reflect the essence of the questions, because I think they were excellent. And a couple that came in before we logged on, the study group for age 5 to 11 was so small. Isn't there concern around the safety? What's the risk of severe infection in kids age 5 to 11? What's the protection of natural immunity versus vaccine immunity? So these are excellent and completely legitimate questions, and they were very politely submitted, which I appreciate. But I heard myself in my own mind as I repeated them, voicing the skepticism of some of the parents. And I think part of the essence of it was, how do you guys, meaning the scientific community, the CDC, the FDA, the various doctors organizations, how do you have the confidence to recommend vaccination for millions of kids. The trial was a couple thousand kids. Isn't this a bit fast? Aren't you all being a little bit arrogant? That's kind of what I heard in my own mind. And I think it's a completely legitimate question. There's an assumption behind the question that we should be explicit about. And that's this, which is that the choice to vaccinate is not occurring in a vacuum of no COVID. The virus is common. It's circulating through the community. So not vaccinating is every bit as much of a choice as vaccinating. And it's a choice to have your child exposed to COVID. And I think we just need to be clear about that. I fully expect to be exposed to COVID. I'm not going to be wrapping myself in saran wrap for the next 5 years. So the choice is between the vaccination and the natural infection. And, I would like to walk everyone through the way I worked out that choice with my own son. And I'm gonna stop there. But when we get into some of the questions, I'd be happy to walk through, because I think it's essentially a math problem. That's what it was for me. And I sat down with a piece of pen and paper, and I walked through what are the risks of natural infection, what are the benefits of natural infection, what are the risks of vaccination, and what are the benefits of vaccination. And I tried to be as dispassionate about it as I possibly can be, because I get a little activated when I see my son getting a needle, but I don't want that to be the reason I make a decision one way or the other. So I'm happy to talk that through, and I'm going to turn it over to Dr. Zimmer.
Thank you, Dr. Dworkin. And we'll have our panelists mute if you don't mind, and then we'll open it up back to you. Let's see. So next up, we're welcoming in Dr. Britta Zimmer, who is a medical director and doctor of naturopathy at Pacific Quest. Welcome, Dr. Zimmer. Thank you so much for spending time with us here this evening.
Hi, thanks for having me. Yeah, so as I've been introduced, I'm the medical director of Pacific Quest. We're an inpatient behavioral health program located here on the Big Island. I've been on the island since 2007, so I feel very dedicated to this community. And like James said, I'm a naturopathic physician. Probably a lot of you don't know quite how we're trained, but we're trained as primary care physicians, but we mostly practice family practice medicine. So we prescribe pharmaceuticals, you come to our office, we'll do the same physical exams, order the same lab tests, but our modalities are more blended, as I call them. We blend conventional with natural. And sometimes we have a different paradigm. We're much better at treating chronic disease. Don't come to me if you have a medical emergency. You go to these other doctors for that. But I think because of my background and my training, I consider myself a COVID vaccine advocate for the vaccine hesitant. And I feel like I have a very good conversion rate to help people trust the information and trust that as a physician, I can help guide them in making their choice. And the one message a couple messages I've tried to relay to people when they're struggling with this choice is, one, there really is no risk-free decision, and there rarely is in medicine. And that's just the hard facts. And I know that's hard to hear, but it's true. But you really have to balance the risk and benefits of whatever decision you make. And also, I really feel that the way through this pandemic is through immunity. And right now, the most certain way we can get immunity is through vaccination. And I'm not one that dives headfirst into vaccinations. You know, I really did the research for myself, for my children. I'm a mother of a 12-year-old and a 15-year-old, 2 daughters. And I really wanted to do research about it before I chose to vaccinate them as well. But I have to say, just admittedly, I got my daughter vaccinated when she was 12 years and 1 day old. So I was right there and ready after I did a lot of research. Also, because I work for this organization that has 100 employees and inpatient patients, I've been tasked over the 18 months of keeping my patients and my employees safe. And just like HPA has been doing, it's no easy task to do this. And there's a lot of policy decisions. And that's why I'm happy to be part of this panel and help people navigate this difficult time. But certainly we know so much more now than we did.
Mahalo, Dr. Zimmer. It's great to have you on the call here with us this evening. I would also like to give a little time to Amanda Bamba, RNC and our HPA Director of Health Services, to really share some information more about our school policies and any sort of practices that are in place right now. Welcome, Amanda. Thanks for taking the time to be here on the call with everyone too.
Yeah, thank you so much, James. I wanted to talk a little bit about community immunity, because if there's anything that the people in Hawaii, whether you're transplanted here or born and raised here, if there's something that we know, it's how important it is to be a part of the community around us and to protect not only ourselves, but those within our extended ohanas. So what community immunity is a really important way to keep both ourselves and those around us safe, whether that's in school, at our sports, at auntie's house, grandma's house. And germs can travel really, really quickly through a community and make a lot of people sick really fast. And that's what we're seeing with COVID. And we're particularly seeing that with COVID-19 in communities with really low vaccination rates. But when enough people are vaccinated, the germs can't travel from person to person as easily. And eventually, as a result of community immunity, diseases become less and less frequent, and sometimes they're eliminated altogether. That's the ultimate goal of vaccination. We can't always get there, but that is an ultimate goal. And it's because of this, the HPA sees vaccination as a key way forward. And I'd love to start having conversations with our principals and our head of school about removing masks. If the governor removed a mask mandate, like, let's start having those conversations. But we can't even begin those conversations until we have a community immunity within our kids and our faculty and staff. And I'd love to get there, but we need to get there with vaccination.
Mahalo, Amanda. Appreciate your guidance there and adding to this conversation. Thank you so much. All right, so we really want to dive into some of the questions that you have. So we have some questions that have come in ahead of time, and feel free to use that chat feature to submit your questions, and we'll do our best to tackle as many as we can here in our time this evening. Let's dive in here. So thank you so much, doctors, for really spending time to address these concerns of our ohana and our families. And really sharing your knowledge and your experience in the field and your practice about this. So let's dive right in here, and I'll kind of guide this as best as possible, but feel free to jump on and add anything to the conversation here. We appreciate your knowledge and your experience here. So Dr. Dworkin, you really kind of started tackling some of these questions here and really sharing them with the community that have been submitted. So let's kind of talk about these a little bit more here. So one of the questions that came in is, the study group for 5 to 11-year-olds was very small. Isn't there concern about its safety? There really maybe wasn't a lot of data about it. Are there concerns about that? How do you feel about this?
Okay, excellent. And again, I just want to validate how important it is that any question relating to safety with vaccination of children is on point. So what I did, and this was the math problem I was referring to earlier for my own family, and I'll just do it in public for anybody who wants to see it, is I looked at the knowns and unknowns, the risks and benefits of natural infection versus vaccination. So we actually have a fair amount of data on what happens when kids ages 5 to 11 become infected with COVID. Because over 1 million kids became infected with COVID last year that were in that age group. So one thing we can say is that deaths are not very common compared to adults. According to UC Davis, which was one of the references I was looking through, there were about 160 deaths in the age group, age 5 to 11. So that doesn't sound like a big number when you're talking about 750,000 dead Americans from the pandemic. To put it in context a little bit, flu was lower, during 2019 before the pandemic in that same age group. We're talking about an infection that is deadlier for kids than flu, but probably not as deadly as some other historic infections like polio, right? And the actual estimated mortality was 0.008%, which is low, right? Hospitalization was considerably higher. It was about 3 times as common. And then there's a couple of other things we care about as well, other than just deaths and hospitalization. There's this MIS-C syndrome, which is the multi-system inflammatory syndrome in children, becoming with fever, elevated inflammatory markers, and then often multi-organ damage of various kinds, cardiac, heart, kidneys, GI. So what this is sort of the immune system having a dysregulated response to the infection. That occurs in about 1 out of 3,000 kids, right? And that can be fairly dangerous. And then there's something called long COVID, which is essentially when the symptoms linger for more than a few weeks. And kids can have problems like headache, fatigue, sleep disturbances, persistent loss of taste and smell. And then the one that kind of concerned me was like fuzzy thinking. So sort of the COVID brain fog. And this is fairly common. This was reported in up to 7 or 8% of kids. It's more common in adults. With adults, it's probably twice that, but it's still 7 to 8%. So that's natural infection. And again, my assumption is if you're not vaccinated, you're going to get naturally infected. This is a virus that infected millions of children last year, despite schools being closed and everybody masking. And as we reopen, it's going to circulate around. The United States is now at over 100,000 cases a day. Hawaii's numbers are going to go up again. Your encounter with this is going to be through vaccination or through natural infection. So that's natural infection. Not as deadly as in adults, but there are some other issues, including the MIS-C syndrome and long COVID. So what about the vaccine data? So there were 3,000 kids in this recent trial. And if anybody wants to look it up, I think I actually linked to it on my Facebook, which is public. It's also on the FDA website. You can Google FDA and you can look through it. It's about 40 pages. Everything that they did is in there. They had a couple of cohorts. So 3,000 kids got the vaccine. There were about half as many kids who got placebo. That's not the only data we have, though, because once the FDA fully authorized the vaccine, there were some kids who got vaccine, even though they were not in the correct age group. So that's actually been happening, not very much in Hawaii, where we've been very tight, but in other places, they haven't been as tight. And we now think that there are a couple 100,000 kids who probably got vaccinated. So there's passive reporting on those kids. So we have some data from that clinical trial, and I just wanted to review with people because this is what I did. So what was the most common thing that happened to kids? Well, in that 3,000 kid trial that we have really detailed information on, 74% had injection site pain. That was the most common side effect, mostly mild, the vast majority of them mild. 6.5% got fever, 39% felt tired, 28% had a headache, and 12% had muscle aches. Those were the common side effects, right? If you compare that to the adult data, I went back and I looked up the original FDA documents for adults. I would compare. You have to remember the Pfizer dose in kids is 1/3 the doses in adults. So it's not exactly the same thing. So in adults, all of those symptoms were more common. It was, 83% pain, 16% fever. Basically, the kids had exactly the same side effects as the adults, but less of it. Big takeaway. And sure enough, when my son got his first shot, that's exactly what it was. He had exactly the same symptoms I had, but more mild. And that's the most common thing I'm hearing from parents of kids is injection site pain. And it usually goes away within a day. The thing everybody worries about, though, is rarer but more severe side effects, right? And that's kind of the elephant in the room. And when you only look at 3,000 kids, you're not going to have enough kids to suss out extremely rare things that are 1 in 5,000, 1 in 10,000, 1 in 50,000. And the one that had showed up in the slightly older age cohort was myocarditis. So in adolescents, and there are different studies looking at this, in adolescents and in young adults, particularly young men, myocarditis was an issue. There were 3 big papers that recently came out on this that were published in New England Journal of Medicine. And one of them was done by an Israeli group where they looked at the entire country because they're all in the same health system. And what they found was that overall myocarditis was about 1 in 50,000, 1 in 100,000. But within the young male demographic, age 16 to 17 men, it was a little bit more common. It was about 1 in 5,000. And most of those cases resolved without any sequela as far as we know. But obviously, there's, in my mind, mild myocarditis is an oxymoron. I don't want any myocarditis. So 1 in 5,000 was the rate. And it was in young men. It was males more than females, and it was 16 to 17-year-olds more than younger kids. So there may be something there that's mediated by hormones, and it may or may not be relevant to this younger age group. But what they did in the FDA document that I talked about was they took that higher rate of myocarditis, the 1 in 5,000, and they assumed, for the purpose of approving the vaccine, that they would see the same thing in the younger kids. Even though, as I just pointed out, it's probably going to be a lower rate. It's probably going to be more like the general population. It's a lower dose of the vaccine, and the rate had actually dropped a little bit as the kids got younger. But assuming it's 1 in 5,000, they did a risk-benefit analysis, and the risk-benefit analysis, based on everything that I just told you about natural infection and hospitalizations and MIS-C and long COVID, clearly favored giving the kids the shot. So I read through all of this. And I thought to myself, am I satisfied with this? And you know, what I really like is to see a study with 50,000 or 100,000 kids. That would be great, right? That would probably take 6 months or a year to do. They did that with polio back in the 50s. There was an original trial that was done with polio that was like 500 kids. And Jonas Salk just wanted to give the vaccine to everybody. And they said, no, we're going to do 100,000 kids. And they took a year to do it, and it showed the same result. And during that period of time, they went through a whole polio summer, and a bunch of kids got polio. So there's a downside delaying a year or 6 months to get better data. And you have to ask yourself, is it going to change what you do? And I think they concluded it's unlikely to change what they're going to do. So they're going ahead. And, you know, for me, doing the risk benefit and doing the math problem that I just did, I felt good about it. So I got my son his first shot, and he had exactly the side effects that were described amongst those 3,000 kids, but mild. And the one area where I may deviate a little bit from the current orthodoxy is they gave him an appointment to follow up at exactly 3 weeks. And there's data from Europe that suggests that the interval of dosing is not, it doesn't have to be 3 weeks. There's nothing magic about that number. In Europe and Canada, they're routinely doing kids at 4 weeks, 5 weeks, 6 weeks. There's some data that suggests it might even be better to do 4 weeks, 5 weeks, 6 weeks. So I think you need the second shot because the immunology data suggests that the second shot is what produces the long-term durable immunity, so that when they get exposed later on, they have a vigorous response, they don't get sick. But there's not necessarily anything magic about that 3 week interval, and I'm a little bit agnostic on that. But Isaac is going to get 2 shots. That's where I'm at with it. And it wasn't a particularly hard decision for me once I did the math and forced myself to be a bit dispassionate about seeing my son get a needle. So I'll leave it at that for now.
Thank you, Dr. Dworkin. Dr. Pulling, did you want to add anything onto that?
Yeah, that was great, Dr. Dworkin, and congrats to your son for getting his first vaccine. I will say he is not alone. As of the middle of this week, the US has now vaccinated 10% of 5 to 11-year-olds with their first dose. And that's 2.6 million US 5 to 11-year-olds. So we're going to get a lot more data in the next couple of weeks. Specifically, you know, what I've been addressing for most parents is the concern about myocarditis, which Dr. Dworkin already talked quite a bit about. But I would like to just give a little reassurance, because I know inflammation of the heart, or pericarditis, which is inflammation of the lining of the heart, sounds extremely scary to parents. I will say, as pediatricians, we definitely see it from other viruses. And the risk from the COVID vaccine, as Dr. Dworkin was saying, is highest in teenage boys and young males, peaking in that 16 to 17-year-old boys. And just like he said, my numbers are a little different. Like it peaks at about 70 cases per 1 million doses given in that age group, 16 to 17-year-olds. You know, for other age groups and among girls, the risk is exceedingly low. So there's ongoing trials and studies right now, but we're thinking this is probably something to do with puberty and testosterone and the immune response in young males. So many experts are thinking that the 5 to 11-year-old boys are going to have a much lower risk of myocarditis or pericarditis since they haven't started puberty yet. And that initial study group of 3,000, little over 3,000 kids, nobody had myocarditis in that group. Also, just so everybody knows too, the cases of myocarditis that we've seen from the COVID vaccine, we did have one in our clinic, have been quite mild and they resolve quickly. Most patients are treated just as outpatients with ibuprofen and rest for a few days. And they do not have any long-term effects. So their heart recovers and they're back to doing their sports, and no effects whatsoever from having that inflammation. But I know it sounds like an awful and scary thing, but I do want to reassure people that it's something that we see from time from time to time from other viruses, from natural infections. And also I want to point out, which Dr. Dworkin also said, MIS-C, or that multi-inflammatory syndrome in kids, and then some of the other long-term COVID effects can damage the heart, and that is much more of a risk because the heart is damaged forever. So, the risk of getting myocarditis from the vaccine, while it's extremely low, the long-term effects are nil. There's nothing. So, just wanted to point that out too.
Thank you, Dr. Pulling. I'd like to bring in Dr. Zimmer here too for some of these questions as well. We've been talking about the vaccine and any risks related to that, but what if we don't have this vaccine for our keiki? What if instead they get COVID-19? What are the severe implications and risks that they run of getting COVID-19? Dr. Zimmer, would you be able to touch on that one a little bit?
Well, the issue is there's a lot of uncertainty around it. So it's not, I wouldn't advise trying to get natural immunity at this point because we're still collecting data on it. That's the problem. I mean, for the most part, as we see there, the younger groups who don't have risk factors are getting over their natural COVID infections. But then again, there is the risk of not only to themselves, but also to their ohana. This age group is very much a vector, meaning they are a source of transmission potentially if they were to get natural COVID. To bring it to their home and to the community is a concern. And getting vaccinated will certainly shorten the length of infection if they were to get infected afterwards, shorten the disease severity, which is really important, and reduce their transmission. And they'll be infected for a lot shorter amount of time if they even were to get it. And again, we're still collecting data on it because we're just starting to vaccinate this age group. But it's just a lower risk through the whole community. And I just wanted to piggyback on something that Dr. Dworkin was mentioning in terms of the interval between the primary series, between the first and second doses. Because I looked at that too, and I did extend the interval for my children because I read too what was going on in Europe, and it was compelling about what the immune response. Now, if you're about to go travel or and your child is eligible, I wouldn't hesitate or delay. I would get both shots. I just want to be clear about that. But if you have some flexibility, something you might want to talk to your pediatrician about. It's something you might want to think about. And also the dose of the pediatric one is, like the other doctors have said, 1/3 of the adult dose. And that could account for why we didn't see any of the bad side effects of the vaccination during this study.
Thank you, Dr. Zimmer. And this is another question that came in here. What is, we saw this with the adult vaccination effort and the rollout for all of that, about emergency approval versus FDA approval. Dr. Pullen, could you touch on that a little bit?
Sure. So for kids, it is just the 5 to 11-year-olds, as well as still the young teens, the 12 to 15-year-olds. It is still just emergency use authorization. We did not, for the 16 and ups, get the federal authorization until this past summer. I believe it was August. So, a lot of people are worried about mandates. They've heard about the state of California and the schools for next year. So I would say really don't worry about the mandates at this point. It's an emergency use authorization. You need to decide what's best for your family. Getting vaccinated obviously becomes a lot simpler for people for travel, coming back to Hawaii when their keiki are vaccinated. They don't have to get a COVID test. For sports, watching, football games. I had a family in the office. They were doing it for the sole reason that the 8-year-old could watch his brother play football. So, people have all sorts of reasons for getting the vaccine, but as time goes on, I do believe this is going to be a very safe vaccine, and I do believe it will get federal approval in the future. But again, I don't, it's still just emergency use authorization in our children. So I don't want people to get too hung up on that. I know we've had quite a few questions in the office about the long-term health effects in kids and adults too, but in kids particularly about the COVID vaccine. People are very worried about that, and everything is new. And they said this vaccine was just rushed. And how do we know that there aren't going to be long-term side effects later on down the line? So I would like to just reassure people that we've never had long-term side effects from any of our childhood vaccines. The side effects that we do see occur within usually the first 2 weeks when the body's mounting the immune response, but up until the first 4 to 6 weeks. Really that's when the immune system's being stimulated, and that's when we'll see the very rare side effects of anaphylaxis, which happens within really the first 30 minutes. And then some, longer things down the line, a couple of weeks later. Sometimes we'll see some side effects like fever or hives or something like that. And again, with myocarditis, that happens most commonly after the second dose and within just the first couple of days of that second dose. I also wanted to address, people are worried that it's an mRNA vaccine, and maybe Dr. Dworkin can talk a little bit more about this, but we have been studying in this country mRNA vaccines for, I believe, 2 decades now and across the world. So even though it's a new type of vaccine, we have been studying this type of mRNA for many, many years. And I would like people to reassure people the body breaks down the mRNA in the vaccine within days. So, it doesn't enter the nucleus and change our DNA or anything like that. So there should be no concerns about that. Right now we've had hundreds of millions of people in the US alone who've received the vaccine, and our earliest study participants are 2 years out. And we just haven't reported, there hasn't been anybody who's reported side effects many months after their shots. So hopefully that reassures some parents.
Thank you, Dr. Pulling. Dr. Dworkin, did you want to add anything onto that too?
Yeah, I wanted to piggyback on some of the earlier stuff about myocarditis. Melissa, you may have mentioned some of this, but there was a big paper that was done in the CDC journal in morbidity and mortality, and they looked at 900 hospitals in 2020. This was before there were any vaccines available, and they found that myocarditis rates were up 42% around the country, and it correlated with COVID waves in different places. So there's been data for some time now that natural infection triggers myocarditis. And one of those Israeli studies that was looking at myocarditis after vaccination also looked at myocarditis after natural infection. And the odds of getting myocarditis after natural infection, they calculated, were 18 times higher than for the regular base population, which was much higher than the rate that they saw with vaccination. And I think what this is telling us is that there's sort of a physical principle here, that when you're getting natural infection, you're not avoiding getting spike protein. You're getting a lot of spike protein, and you're getting nucleocapsid protein, and you're getting all the other viral proteins that are part of the virus, right? So you're going to have an immune response to that, and some people are going to have a dysregulated immune response to natural infection. And I see this all the time as a clinical infectious disease person. Somebody has a natural infection. They have a kind of dysregulated immune response to it. They show up in my office sick with symptoms. Oftentimes, they're clearly no longer infected, but they're having all of the post-infectious syndrome type symptoms. And sometimes those can be quite severe. With sepsis, that's often what kills people, is the immune response to the infection. So it's not surprising to me that we were seeing a lot of myocarditis after natural infection. And that's one of the reasons why the 1 in 5,000 myocarditis rate, which was the highest rate reported, not overly alarm me, even though I didn't like it, because I know that that's going to happen if my kid gets, there's a higher chance of that happening after a natural infection. So yes, I just wanted to point that out as well.
Thank you, Dr. Dworkin. This next question, I'd really like to bring in Fred and maybe Amanda, you want to chime in on this as well, and could be supported by our doctors about, as you see in your place of work, in your institution and other institutions, what is the justification for mandates? We're seeing this, for our older kids and potentially in the future for our younger kids. Fred, did you want to start with that one?
Sure. I think, mainly it's following, the advice of the professionals. We look at the CDC, we listen to our practitioners, and we follow the data and their lead. And not to minimize our role in this, we have a huge role in terms of impacting our community in a positive way. We also run the risk of impacting our community in a negative way. So we take that responsibility seriously. But our mission is dependent on us being able to be the best academic institution we can be. And that relies on being able to see our students face to face, being able to eventually see our students without masks, and being able to go on excursions and do the things that make our school special. And so we want to follow the path that's provided by the vaccine and the information that supports that it's the best path forward for us. So our goal is to get better. We certainly are, have made normal and done the best to our ability to keep everyone safe and to meet our program standards. But we know that testing students as much as we are and using all the risk mitigations, they're not HPA at our best, and they're probably not academics and academic life at its best. So that's really why we want to continue to follow the lead of the professionals and also try to keep our community as safe as possible.
Thank you, Fred.
If I could chime in there, just to add on, everything Fred said is spot on. And I've had conversations with parents that, they're concerned about vaccine mandates because the numbers currently in our community are, quite low if you compare them to other places in the United States, and that's accurate. But we know that this virus waxes and wanes, and we want to be proactive and not reactive. And the way to be proactive is through vaccination, because if we wait until we're having a spike in the community, you have 5 weeks from the first dose until you're fully vaccinated. The first dose, 3 weeks, you get the second dose, and then 2 weeks later is when we consider you fully vaccinated. And we can't be reactive. We need to protect each other now.
Thank you, Amanda. There was a question that came in about, doctors, you mentioned a little bit about the dose. The dose is different than in adults. Could you really elaborate that a little bit more? Their question was really about the formula and the formulation of the vaccine. If there's any difference between adults and keiki, and really just be clear about how different this dose is for our adults and children. Dr. Zimmer, did you want to take that one if you wanted to start with that?
Sure. Like I said before, it's 1/3, and it really goes by birth date. Vaccines are not weight dependent. They never have been. Forever, we've been giving the flu vaccine. We give a higher dose to older people because their immune system isn't as robust, and we need to stimulate more of a reaction, more immunity to it. So it's birth date dependent. And the last I read, and I'm sure Dr. Pulling will be able to correct me if I'm wrong, but if you get your first dose when you're 11, it will be 1/3 dose. But if the second dose comes when you're 12, it will be the full dose. That's what I read, and we're still going by that. Okay.
Yeah, that's correct.
Okay, so right there you see it's really birthday dependent. Yeah, and then the other thing, just to piggyback a little bit on the mandate question, there's a real interruption of life when you get COVID. COVID, the natural infection, provides a risk to others, whereas getting the vaccination does not. So to really think about the interruption to these busy children's academic life, their extracurricular life, how getting an infection, if you're unvaccinated, how that changes the quarantine period times, and how that is going to sideline your whole ohana. So it's just really something to think about. These mandates is kind of a collective push to protect everybody at the same time.
I wanted to talk
Dr. Pullen.
just briefly on what Dr. Zimmer was saying too, to elaborate a little bit on, the mental health effects for our kids too. They've really suffered during COVID, and I'll have kids in the office who they themselves want to get vaccinated, but their parents don't want them to. And a lot of kids have put quite a bit of, they know what's going on, and they don't want to give COVID to their grandparents or their family. And there's a real sense of relief when kids get vaccinated, and they're really quite happy. So I know as parents, we want to do the right thing and not make a mistake, but I do think it's important to involve your child also, because we've really seen some terrible cases of depression and anxiety this past year in particular.
I'll say one more thing about the formulation. It's the same.
Oh, yeah.
And if you were to look at all the other vaccinations, and some of those vaccine hesitant people get concerned about adjuvants and other ingredients that are added to vaccinations to stimulate immune response, this mRNA vaccination is really clean. It has a lipid adjuvant that helps stimulate the immune system. And so that's one thing I really looked at, because this is something patients ask me often, what else is in it? What else might I react to? And it's not to mention, we say the flu vaccine sometimes is 50% effective, the effective rate of 90%. I mean, they kind of nailed it with this one. I was surprised when that information was coming out. So if we were really to be presented with any vaccination, this is a good one. And I think we all came to that conclusion, early on. Of course, all of us probably got vaccinated in January or December. So, yeah.
Thank you, Dr. Zimmer. Really want to be clear on this with our audience, and I'll lead off with Dr. Dworkin here. Is there really a benefit to vaccination? And the risk is really low from natural infection for our 5 to 11-year-olds. Is there really a benefit to vaccination? Should we really be seeking this?
Yeah, I tried to get at that with my little math problem, which to me was the way I answered that question. If you had asked me before the FDA data dump that same question, I would have said, I don't know. I'm waiting for the data, right? I want to see, right? I would never endorse a vaccine in advance of the data. I looked through the data, and I read those myocarditis studies fairly carefully as well, even though I think they're probably going to dramatically overestimate the risk in this age group, just because I wanted to have a worst case scenario in my mind. And the conclusion I came to was that the benefit clearly favors vaccination. It was not particularly close. It's definitely more of a gray area in kids than it is in adults, because the mortality is so much higher in adults, right? So you do have to think about it. But for me, the really compelling thing in kids was the MIS-C experience, and also the long COVID experience, and reading about kids with headaches and fuzzy thinking and absenteeism from school, and I'm seeing this in adults too. There's something called MIS-A. So all these millions of adults that were living in states with unenlightened policies on disease control last year that got COVID, how many of them are going to end up on disability? How many of them are going to end up with cognitive hits? I mean, there's stuff that we haven't even begun to deal with coming out of this pandemic. So it's not just death or no death. There's other things we care about. I'm rather fond of my son's brain. I want every IQ point. So for me, that was part of the calculation. It wasn't just about death. I know he's not going to die if he gets COVID, but there's other things that could happen that I want to avoid. And then there's all the social and psychological benefits of not having to worry about being a vector, being able to resume more like a daily routine, more like normal life. When my older son got his vaccine, he suddenly got his life back. He was traveling inter-island and staying over at friends' houses and doing much more normal things than he was able to do before. And I think that's a big part of the point. I don't want to get too into vaccine mandates, but I just want to point out a couple of historical curiosities. The first vaccine mandate in Hawaii was in 1854 in the Kingdom of Hawaii by the Hawaiian monarch for smallpox vaccination. There was an epidemic in 1853 that killed about 7,000 Native Hawaiians. And the Queen's healthcare system emerged out of that epidemic in 1859. But the very first vaccine mandate in Hawaii was in 1854. In the United States, it was during the Revolutionary War. The first vaccine mandate was George Washington, and he vaccinated the Continental Army. At that time, it would have been variolation, which was the precursor to vaccine. So this stuff goes back hundreds of years in our history. It's not new at all. I think what's new is the rancor around it. I'll leave it at that.
Dr. Pulley, yes.
Yeah, I'd like to just elaborate a little bit more on what Dr. Dworkin was saying. So yes, it's true COVID is less severe in children than adults, particularly older adults, but it's incorrect to say COVID is benign in kids. In Hawaii, we've seen 2% of our infected kids that required hospitalization. And our children's hospital, Kapiolani in Honolulu, was at full capacity during our surge in August and September. Those were pretty scary times. COVID-19 is now the 8th leading cause of death in children in the US. We've had over 700 COVID deaths in children. Yes, only 160 in the age group for 5 to 11, but total children that have died from COVID is 700. So that is by comparison with flu. Somebody asked a question about flu deaths. Well, in all of children, they range from, in the highest years, 100 to 200 per year. So we're way over that with COVID. So COVID is much more, especially this summer, with the Delta variant, is much more infectious and seems to be bringing a lot more kids to the hospital and causing more death than influenza. A lot of people think it's just children who have underlying conditions. That is not true at all. They are more at risk if they have obesity or asthma or some immune diseases, or even ADHD they're more at risk. But we've seen plenty of kids who have not had any underlying conditions who have been very sick with COVID. We've had more than 8,000 hospitalizations of children just in that 5 to 11-year-olds group. But I'm with Dr. Dworkin, and that what really scares me the most is long COVID. And just in our office at Paniolo Pediatrics, we've seen quite a decent number of teens now that got COVID in the spring and summer, and they're still having the neurologic effects of brain fog, fatigue. Some of them have had weight loss issues because of the loss of smell. Some are having chronic headaches and migraines. So that's personally what I worry about. And yes, long COVID does seem to be more between like the 5 to 10% of kids compared to adults. It's a higher percentage, but still that's not something I would want to take a chance with.
Thank you, Dr. Pulling. This is a wonderful conversation we're having here with our community doctors and our administrators here at HPA. Looks like we've spent a lot more time with all of you. There are a lot of questions that are coming in, of course, so grateful for your knowledge and your contributions to learn more about this. Apologies if we're unable to reach a lot of your questions that were coming. We're sure getting a number of them now. But if you do have further questions about, school policy, please contact the HPA staff. You can email them at safety@hpa.edu. And if you do have any other additional medical or health concerns or questions, let's please reach out to your healthcare providers, your primary care physicians in the community here. So we're grateful for those questions and your interest around this topic. And as we kind of reach the end here of the conversation, I would like to bring back in our interim head of school, Fred Wawner, to really say a last few words with us this evening. Fred?
Thanks, James. I just want to express my gratitude to our panel and to our audience. I know your parents, you've done a great job following our protocols. You've hung in there with us through some really tough times. Our kids, your kids, do an amazing job every day, trying their best to follow our protocols and procedures. And I want to honor that this is a challenging time and these are challenging decisions. So I appreciate the respect that everyone's given us in terms of having to make some hard decisions. And I'm hopeful. I know that I learn a lot every time we do one of these panels. So I'm really grateful for the information share. We'll do our best to reach out to our doctors with questions that we don't have the answers to get you information that you need. And again, we want to honor that every family has, some decisions to make. And so our role is to give you as much information as we can. So thank you for everyone. We're very grateful, and we, in the season of gratitude, thank you very much. And also James Eustace, if everyone can tune in monthly to the Waimea Community Association, he does amazing things, and you'll learn a lot there as well. So thank you, everyone. Thank you, James. Thank you, Mileka and team. Aloha.
Thanks, Fred. Thanks, Fred. That was a nice plug. Thank you so much. Because we close here tonight, I just once again thank our doctors, Dr. Dworkin, Dr. Pulling, Dr. Zimmer, for taking the time to be with us here this evening, for your mana'o, your knowledge in guiding us and helping us make the best choices for our keiki and our overall community. Mahalo nui to you. And of course, mahalo to Fred, Amanda, and our Marcom team at HPA for putting together this forum and this webinar, and for connecting with our HPA Ohana in this virtual setting. And of course, thank you to our Hawaii Preparatory Academy families and friends for joining us this evening. A recording of this meeting will be made available for you to revisit. It should be up on the HPA YouTube channel at some point, so please look for that if you would like to revisit and rewatch this recording. Thank you everyone for joining us. Stay safe. Happy holidays. Have a nice evening. Aloha.